talk to us a little bit about how we use protocols and patient education to help recovery. There's a name for a system that we have at the hospital
Yes.
for enhanced recovery.
Yes.
That has no system in the United States is better than this.
Yes. So
Teach us this.
The enhanced recovery system.
What a segue.
I know, right? It's called ERAS is the nickname for it. And basically we use this as a way of, one, starting before surgery to get you prepared by making sure you're hydrated and you've had enough fluids, you have enough nutrition in your body.
Your protein levels are up.
Exactly, your protein levels are up, so they recommend different protein drinks to take in prior to surgery. For example, a colon surgery. Everyone knows about the wonderful bowel prep you have to do before a colonoscopy. That can really drain you. And so this is to give you back that hydration that you lose. Then it's all about controlling your pain prior to surgery, preventing those pain fibers from being stimulated before you start.
Huge fan of that. Don't
Yes.
invite them to the party.
Exactly.
Right.
So before surgery, you may have Tylenol that they give, simple pain reliever. Some other pain relievers, Lyrica is another one that helps keep the nerves from being stimulated. Then we have wonderful blocks that our anesthesiology department perform.
And by blocks, we're talking about injections of numbing medicine.
Yes. So basically they use long-acting numbing medication. You hear about lidocaine and Novocaine. These are more advanced numbing medications that last anywhere from 12 to even 36 hours after surgery, that they do injections along certain nerve endings to keep them quiet so your pain is a minimum. So they inject those. So we're looking at every way to prevent pain. And then we monitor you during your surgery, giving certain amount of fluids based on your weight, your heart condition, your lung conditions. We take into account of all of that. And then after surgery, we have a protocol of how soon after surgery you eat, how soon after you drink, even when do you get up and get out of the bed after surgery to start walking in the hallways to help stimulate your intestines, your lungs, your heart.
Prevent blood clots.
Prevent blood clots from happening. That's all encompassed in this protocol that the orders are written for you, so I don't have to remember, did I miss something?
Right.
It's already there, and the nurses know what to do.
Protocols lower complications.
Yes.
They are procedurals that are designed by what we call medicine. Well, the phrase exists in other fields as well. It's called best practices. We learn from mistakes.
Yes.
We learn from ours, but not just ours. We learn from other people's mistakes, and that's critical.
Yes.
And that's the advantage of being part of a big system, is that your protocols, which are set up on best practices, are not just your experience.
Exactly.
It's thousands of doctors' experiences.
And it's
to make it right.
ERAS. That's the name for it.
ERAS, yes.
Okay.
And-
That's relatively new, isn't it?
Yes, it's probably in the last 3 to 5 years we've been pushing more towards it, and some surgeons and doctors have kind of picked at pieces that they wanted to implement because they were worried about how quickly things were being done and how to adjust for the particular patient you're dealing with. So you still can kind of customize it, and we still look at the patient's history and adjust it for that, but we have a basic protocol.